New research shows that men who stick to a predominantly Mediterranean diet are less likely to be diagnosed with prostate cancer. This diet also improves their chances of recovery if they have PC and are undergoing radiation treatment. Men who consume colorful fruits and vegetables on a regular basis are less likely to be diagnosed with prostate cancer, PC, according to new research by University of South Australia scientists. A rainbow of foods rich in certain micronutrients helps to prevent prostate cancer, PC, as well as speed up recovery among men who undergo radiation treatment for the disease. The findings, from 2 studies published in the journal Cancers, highlight the importance of a Mediterranean or Asian diet that includes these foods. Researchers compared micronutrient plasma concentrations of prostate cancer patients with a healthy control group, revealing low levels of lutein, lycopene, alpha-carotene, and selenium in PC patients and high levels of iron, sulfur, and calcium in the same group, relative to controls. Increased DNA damage after radiation exposure was also associated with low lycopene and selenium in blood plasma. Men with plasma concentrations lower than 0.25 micrograms per milliliter for lycopene and or lower than 120 Ug/L for selenium have an increased risk of prostate cancer and are likely to be more sensitive to the damaging effects of radiation. Foods that are rich in lycopene include tomatoes, melons, papayas, grapes, peaches, watermelons, and cranberries. Selenium-rich foods include white meat, fish, shellfish, eggs, and nuts. Eating foods that are naturally rich in lycopene and selenium is preferable to taking supplements, where the benefits are limited, according to previous studies. It is recommended to adopt a Mediterranean diet enlisting the help of a dietitian because people absorb nutrients in different ways, depending on the food, the digestive system, the person's genotype, and possibly their microbiome. Prostate cancer remains one of the most common and fatal cancers in men, but the nutritional deficiencies associated with it remain largely unknown, hence this study. Other risk factors, such as ethnicity, family history, and age, have previously been linked to prostate cancer. There is strong evidence that being overweight and tall increases the risk of prostate cancer. Diets high in dairy products and low in vitamin E may also increase the risk, but the evidence is less clear. Vitamin E is found in plant-based oils, nuts, seeds, fruits, and vegetables. The research is the first to evaluate plasma concentrations of micronutrients and trace elements with respect to prostate cancer. Your genes hold precious clues about your nutritional needs and dietary requirements. They influence how you respond to various diets, including the Mediterranean diet. Your genes hold precious clues about your nutritional needs and dietary requirements. They influence how you respond to various diets, including the Mediterranean diet. The Med diet may support heart health and reduce cardiovascular disease risk. A 2021 randomized controlled trial reports that long-term consumption of the Med diet may help slow down plaque buildup in the arteries, bringing down the risk of heart attacks and strokes. A 2022 review study reports that a Med diet helps bring down the risk factors associated with cardiovascular diseases and also supports glycemic control. A 2021 study reports that adhering to a Med diet for an extended period increases gray matter volume in the brain, improves memory, and reduces the risk of cognitive decline. A 2014 study analyzed the relationship between Med diet adherence and the risk of developing Alzheimer's disease, AD. Cortical thinning in the brain is associated with cognitive impairment and an increased risk of memory loss. According to this study, individuals who adhered to a Med diet regularly had a lower risk of cortical thinning, which may have a protective effect against AD. The presence of high levels of omega-3 and omega-6 fatty acids and flavonoids in the Med diet may help support mental health. A 2019 Australian randomized controlled trial analyzed the effects of a Med diet on people struggling with depression. The participants were assessed for mental health improvement and quality of life after 3 months of following a Med diet. At the end of 3 months, the study reported reduced depression and improved quality of life scores in those who adhered to the diet plan. A meta-analysis study reported that adhering long-term to a med diet may bring down the risk of depression by 30%. The Mediterranean diet has been associated with a decreased risk of many types of cancers. A 2021 meta-analysis analyzed the results of 117 studies involving 3,202,496 participants. The study reported that higher adherence to a med diet lowered cancer mortality risk. This included liver, bladder, gastric, head and neck, colorectal, and respiratory cancers. Med diet is a success among people wanting to lose weight because it isn't as restrictive as other diets and has healthy and tasty food options. A 2020 study reports that people who adhered to a med diet for a more extended period had a 2-time increased likelihood of maintaining weight loss. A similar 2022 study analyzed the ability of 470 adults to maintain their lost weight in 12 months while on med diet. This study reports that higher adherence to the med diet was associated with a better likelihood of maintaining weight loss. Men may genetically inherit the risk of developing prostate cancer. Apart from that, dietary and lifestyle habits may also influence the condition. Consuming the following foods may increase people's risk of developing prostate cancer: excess red meat, grilled and charred meat, processed foods, foods containing high saturated fats, refined foods, excess sugar. A 2023 Australian study analyzed the effect of a med diet on prostate cancer and reported that people who adhere to the diet regularly have a lower chance of being diagnosed with prostate cancer. Cyro Human Nutrition and the Royal Adelaide Hospital conducted this case-controlled study. It analyzed the lab reports of adult men diagnosed with prostate cancer and compared the values to a control group. If moving to a med diet seems overwhelming right away, here are some tips to get the diet started. Try choosing unprocessed, fresh meat over processed meat. Include at least 2 portions of whole grains in the everyday meal. Swap red meat for seafood and fish. Pick olive oil instead of butter, margarine, or vegetable oil for cooking. Have a side salad of greens and vegetables with every meal. Snack on nuts. Choose fruits for dessert. Drink red wine instead of other kinds of alcohol in moderation. Try to cook more at home than ordering takeouts. Pick different types of cheese and use them in moderation in your diet. Investigations found that the white blood cells from patients with prostate cancer had more DNA damage in comparison with the control group. Patients with prostate cancer were also found to be more prone to ionizing radiation-induced 3-Grays DNA damage, given that when the cultured white blood cells of prostate cancer patients with low selenium and lycopene were exposed to 3-Grays radiation, the cells showed increased chromosome instability. This indicated that the excess of DNA damage in patients with prostate cancer may be explained by lower levels of selenium and lycopene in the blood. The authors concluded that higher dietary intakes of lycopene and selenium could help reduce DNA damage to white blood cells as well as reduce the overall risk of prostate cancer. A study analyzed the concentration of micronutrients in plasma of men who received a diagnosis of late-onset prostate cancer compared with that of healthy age-matched controls. Data showed that the plasma concentrations of lutein, lycopene, alpha-carotene, beta-carotene and selenium were reduced, and levels of iron, sulfur, and calcium were increased in the prostate cancer cohort. The investigators point out that these micronutrient patterns are indicators of a Western dietary pattern rich in dairy and meat and lacking in plant-based foods. Researchers suggested that the concentration profile of these micronutrients in patients may serve as an indicator to determine those who have a higher risk for prostate cancer. The results from both studies point to adopting a diet with more colorful fruits and vegetables, such as the Mediterranean diet, as opposed to a Western diet or taking supplements. Men who consume colorful fruits and vegetables on a regular basis are less likely to be diagnosed with prostate cancer, PC, according to new research by University of South Australia scientists. A rainbow of foods rich in certain micronutrients helps to prevent prostate cancer, PC, as well as speed up recovery among men who undergo radiation treatment for the disease. The findings, from 2 studies published in the journal Cancers, highlight the importance of a Mediterranean or Asian diet that includes these foods. Researchers compared micronutrient plasma concentrations of prostate cancer patients with a healthy control group, revealing low levels of lutein, lycopene, alpha-carotene, and selenium in PC patients and high levels of iron, sulfur, and calcium in the same group, relative to controls. Increased DNA damage after radiation exposure was also associated with low lycopene and selenium in blood plasma. Men with plasma concentrations lower than 0.25 micrograms (Ug) per milliliter (ml) for lycopene and or lower than 120 Ug/L for selenium have an increased risk of prostate cancer and are likely to be more sensitive to the damaging effects of radiation. Foods that are rich in lycopene include tomatoes, melons, papayas, grapes, peaches, watermelons, and cranberries. Selenium-rich foods include white meat, fish, shellfish, eggs, and nuts. IT is recommended to adopt a Mediterranean diet, enlisting the help of a dietitian because people absorb nutrients in different ways, depending on the food, the digestive system, the person's genotype, and possibly their microbiome. Prostate cancer remains one of the most common and fatal cancers in men, but the nutritional deficiencies associated with it remain largely unknown, hence this study. Other risk factors, such as ethnicity, family history, and age, have previously been linked to prostate cancer. There is strong evidence that being overweight and tall increases the risk of prostate cancer. Diets high in dairy products and low in vitamin E may also increase the risk, but the evidence is less clear. Vitamin E is found in plant-based oils, nuts, seeds, fruits, and vegetables. Foods rich in lycopene include tomatoes, melons, papayas, grapes, peaches, watermelons, and cranberries. Selenium-rich foods include white meat, fish, shellfish, eggs, and nuts. Prostate cancer remains a leading cause of cancer death among men. These new studies shed some light on the connection between nutrition, cancer, and cancer treatment, which could lead to more effective nutritional therapy for men with prostate cancer.